Listen, if you've ever felt that sudden, burning pain that literally just stops you in your tracks, you already know. A urinary tract infection is incredibly disruptive, and honestly, it's something that demands immediate attention. So today, we're jumping right into a brand new explainer dedicated to demystifying the science behind UTIs, and more importantly, figuring out how to get rapid, effective relief. We're going to use the clinical protocols and services from Mederi Urgent Care in Los Angeles as our real-world guide to map out exactly what's going on in your body and how modern urgent care steps in to fix it fast.
Here's our roadmap for the explainer today. 1. Understanding urinary tract infections. 2. The fast treatment process. 3. Comprehensive UTI care services. 4. Real patient experiences. And 5. Accessing care in LA.
All right, Section 1, Understanding Urinary Tract Infections. Let's get into the basics.
To kick things off, we really need to look at the numbers because they are pretty wild. UTIs affect up to 10 in 25 women. If you do the math on that, we're talking about a staggering 40%. Now, it's widely thought of as just a women's health issue, but that's actually not the whole story. Up to 3 in 25 men are also affected. These statistics absolutely validate why we need to be talking about this openly instead of suffering in silence.
So, what's actually happening inside the body? Basically, a UTI is an infection of your urinary system. But here's the really key takeaway. It isn't just limited to one single spot. Your urinary system is a connected pathway. So depending on the cause, this infection can set up camp in your kidneys, your ureters, your bladder, or your urethra. Basically, if bacteria gets into the system, it can wreak havoc at multiple different levels if you leave it unchecked.
And there's a very simple anatomical reason behind those prevalence numbers we just talked about. Women are at a much higher risk simply because of how the female anatomy is structured. The female urethra is located near the anus, which just allows harmful bacteria to enter the urinary tract a lot more easily. Men have a lower risk because their anatomy creates a longer physical distance for that bacteria to travel. But again, anyone can still get a UTI. It's really just a matter of anatomical geography, not bad luck.
Moving right along to Section 2, the fast treatment process, and finding a clear path to relief.
Okay, so how do we actually fix this? Let's walk through the 3-step playbook used over at Mederi Urgent Care. Step 1 is a quick diagnosis. They do a comprehensive evaluation and a urinalysis, basically testing your sample for bacteria, white blood cells, and red blood cells to actually confirm the infection. Step 2 is same-day treatment. You aren't sitting around waiting. If it's a UTI, you get antibiotics prescribed immediately so you can start clearing up those awful symptoms that very same day. And step 3 is prevention guidance. They don't just hand you a pill bottle and shove you out the door. You get personalized advice on hydration, hygiene, and lifestyle tweaks to stop that infection from ever coming back.
Now, if you take away absolutely anything from our explainer today, let it be this time frame, 24 to 48 hours. That is typically how incredibly fast patients feel significantly better after starting those same-day antibiotics. When you're dealing with the severe pain of a UTI, knowing that a massive drop in symptoms is literally just a day or two away, that is a huge relief.
Section 3. Comprehensive UTI care services. Taking a look at the more complex cases.
We just covered the standard same-day testing and antibiotic treatment, but what happens when things aren't so simple? For patients dealing with frequent, stubborn infections, there's recurrent management. This involves prevention strategies like low-dose antibiotic prophylaxis, post-intercourse antibiotics, and targeted lifestyle modifications to actually break the cycle. And then there is complicated care. If your UTI comes with a fever, kidney involvement, or really severe symptoms, they evaluate and treat it comprehensively. We're talking imaging studies if needed, specialist referrals, and strict follow-up care to pinpoint any underlying causes. It's a true full-spectrum approach.
Let's move to Section 4, Real Patient Experiences and Real Stories.
I always love sharing these because it really brings out the human side of medicine. Here's a verified 5-star review from Rodrigo M., who visited the Hollywood location. He said, "Nice, professional, and quick. Both the staff and Dr. Nordland went above and beyond, making a bad situation better. A UTI is definitely, without a doubt, a bad situation. But having a clinical team that acts with professionalism and speed, that is exactly what transforms a stressful emergency into just a minor, manageable bump in the road." And finally, Section 5, Accessing care in LA, specifically at Mederi Urgent Care.
For those in the LA area, Mederi Urgent Care has convenient locations scattered across the region: Hollywood, Glendale, Los Feliz, Burbank, and La Crescenta. And a huge perk here is their hours. They are open Monday through Sunday. Yes, all 7 days a week from 9 a.m. to 9 p.m. Plus, if you're near Los Feliz, they are open from 10 a.m. all the way until 10 p.m. Because let's be real, infections absolutely do not respect a standard Monday to Friday 9 to 5 schedule, so your urgent care should neither.
And while we've been super focused on UTIs today, Mederi is a complete, full-spectrum urgent care hub. Beyond UTIs, they offer rapid COVID-19 testing, quick treatment for ear infections, IV hydration therapy to get your fluids back up, complete on-site lab services, a physician-supervised medical weight loss program, and care for minor injuries like sprains, cuts, and burns. Basically, they've got you covered on all fronts.
Which brings us to an important question to wrap up on. Are you ready to prioritize your health? Whether you're dealing with a really painful UTI or just a minor injury, the solutions are fast and highly accessible. But looking at this level of rapid, comprehensive care, it really leaves us with a fascinating, larger question. As urgent care clinics evolve to handle these increasingly complex issues with basically zero wait times, is the traditional, crowded hospital emergency room kind of becoming a thing of the past? Thanks for joining me on this explainer. Keep learning, stay healthy, and I'll catch you next time.